Now to a big story everyone's been talking about since the New York Times hit newsstands today. Oscar-winning actress Angelina Jolie revealed she had a voluntary double mastectomy. The actress says she underwent the procedure after discovering she has a potentially deadly BRCA gene that put her at an 87% risk of getting breast cancer. She said it was her children she was thinking about when she made her decision and shared her personal story in hopes of helping others consider it. And tonight we're joined by Dr. Peter Capizzi of Stillwater Plastic Surgery and Tiffany Newcomb, a mother of, you have three?
I have three, yes.
And you recently underwent a double mastectomy as well. Did you test positive for the BRCA gene?
I did not. I just had a history of breast cancer in my family with my grandmother and my mother, both in their 30s.
Yeah, it's such a big decision to make. I'm sure it's a very difficult decision. Doctor, what are you doing when it comes to counseling patients about something this big and this important?
Well, the first thing you have to see is what their intent is and if they have a good support system, and Tiffany does.
Yeah.
She's got great support from her family, and that's half the battle.
And and you said that nobody tested for the BRCA gene, and yet your mom and your grandmother had breast cancer in their early 30s?
That's correct.
So I guess this gives you a pretty big sense of relief. There is still a percentage that you might possibly get breast cancer, but was it the relief that you were looking for?
It was. Starting at 24, I started having abnormal mammograms and lumpectomies and several different things that had happened. So once I started finding the atypical cells at the last biopsy, I decided it was time, because I did not want my children to have to see that.
And confidence-wise, so many women talk about a mastectomy as something that they feel like they won't be feminine, and yet you've had reconstructive surgery, and you were involved in that process. And I guess in the end, do you feel like you made the right decision?
Oh, absolutely. And I feel almost better than when I started.
Really?
Absolutely.
Yeah, and I think, Doctor, what I have to ask you, this is your expertise. This is what you do. Are you seeing more women coming in and doing this voluntary mastectomy in hopes of preventing the battle of breast cancer?
Absolutely. In the last 5 years, it's not only just preemptive mastectomy or prophylactic mastectomy, but it's also bilateral. It's not just one side.
Mm-hmm.
We definitely see an increase in that.
Well, I wonder what the percentage, how much it decreases the percentage of possibility of getting breast cancer. I wonder what the number is. Do you know that?
I don't know the specific number, but it's, virtually, if you're doing a mastectomy, that's the gold standard.
Mm-hmm.
So, although theoretically there are some cells, but it would be very high.
Well, Angelina Jolie has certainly opened up a dialogue that we probably never would have had, and we've got lots more details about Angelina's decision to do that, and we appreciate you, Tiffany,
thank you
for
very
coming
much.
forward, and I'm sure there are other women out there who may be experiencing your same family history, and this may give them an idea. And Doctor, it's great to see you.
Nice seeing you too.
Thanks for being here, Peter.
Thank you.
And outside right now, we're going to talk about the weather. Eric Thomas, we had one of those gorgeous days that we said was a spring day, and now we're hearing summer's already arriving.
It's